Welcome to Pulse&Pressors, where critical care gets crystal clear. Part 2 focuses on advanced cardiogenic shock physiology. It builds beyond standard parameters to include coupling, coronary perfusion, device management, microcirculation, and failure patterns that only become obvious when all systems are integrated. The shock spiral explains why cardiogenic shock accelerates rapidly. Low forward flow raises LVEDP, reducing coronary perfusion and worsening ischemia, which further depresses contractility and amplifies shock. Shock worsens because coronary perfusion falls, ventricular wall stress rises, catecholamines increase afterload, microcirculation collapses, and organ injury feeds back into hemodynamic failure. This loop must be broken early. Coronary perfusion pressure is determined by diastolic aortic pressure minus left ventricular end diastolic pressure. In cardiogenic shock, elevated LVEDP severely reduces CPP. Norepinephrine improves coronary perfusion pressure, or CPP, by supporting diastolic pressure, and IABP augments diastolic flow. Ventricular-Arterial Coupling, or VAC, compares afterload to contractility. The ideal ratio is about 1.0. In shock, afterload dramatically exceeds contractility. VAC becomes 2 to 3, indicating mismatch requiring mechanical support. EES, end systolic elastance, reflects contractility, and EA, arterial elastance, or load elastance, reflects afterload. Inotropes increase EES, and vasopressors increase EA. Impella directly unloads the ventricle, reducing EA while increasing effective EES, restoring coupling. Inotropes fail when contractility cannot overcome excessive afterload. Even maximal inotropy cannot normalize VAC. Mechanical devices become the only way to correct the imbalance. Lactate is not always low flow. It can be elevated due to beta-agonist stimulation or impaired clearance. Understanding which lactate phenotype is present prevents unnecessary fluid or inotrope escalation. Advanced endpoints such as SVO2, the CO2 gap, VTI trends, and improving CPO provide a more complete picture of perfusion than MAP alone. These metrics guide precision resuscitation. Microcirculatory failure explains why some patients remain in shock despite what appears to be adequate MAP and flow. Capillary derecruitment and glycocalyx injury impair oxygen extraction. Microcirculatory assessments include organ Doppler, Vexus grading, portal pulsatility, and renal congestion markers. These tools detect organ-level perfusion deficits early. The RV shock algorithm focuses on optimizing preload, reducing RV afterload, improving RV contractility, and transitioning early to mechanical support when needed. Reducing RV afterload is essential. Inhaled vasodilators, low PEEP, treating hypercapnia, and minimizing airway pressures all reduce RV strain and improve output. Device complications include Impella suction events, ECMO-related left ventricular distension, Harlequin syndrome, and hemolysis. Recognizing these patterns early prevents deterioration. Troubleshooting includes adjusting Impella P levels, verifying device position, adding LV vents to ECMO, managing purge issues for hemolysis, and ensuring adequate preload for RV devices. Mixed shock occurs when low cardiac output coexists with vasodilation. These patients require simultaneous pressors for SVR and inotropes for output. Fluids should be avoided if congestion is present. Echo clues to mixed shock include a hyperdynamic but underfilled ventricle, high Vexus score indicating congestion, and possible dynamic LVOT obstruction. These require nuanced management. Integration of VAC, CPP, VTI, CPO, PAPI, and Vexus creates a comprehensive hemodynamic picture. No single variable is enough. The pattern determines the diagnosis. The case example demonstrates how low CPO, low VTI, high congestion, poor RV performance, and low SVR signal the need for combined pressor, inotrope, and mechanical support early. Mastery requires recognizing coupling, microcirculation, and mixed physiology while anticipating device complications. These advanced concepts transform cardiogenic shock management. This is Pulse&Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.